Douglas, Arizona loses its hospital. What longtime residents think will become of their border town.
I'd love to say the future looks bright, but from where I'm standing, it's not looking so bright.
Are rural hospitals across the country in danger of closing, and what that means for other businesses?
It also affects the economic development in that community. It's hard to attract new businesses if you don't have a very high quality, accessible health system.
This is Arizona Week. Hello, I'm Christopher Conover, in for Lorraine Rivera. For those of us who live in Tucson or Phoenix, we rarely think about pulling up to the emergency room only to find a closed sign on the door. Cochise Regional Hospital in Douglas shut its doors a little more than a month ago, and that closed sign is exactly what's waiting for more than 18,000 residents of Douglas. Pull into the parking lot of the hospital in Douglas, and it's clear the hospital is closed. The helicopter is on standby to fly people to Tucson for trauma, but short of that, residents who need a hospital must travel to Bisbee.
A week before they closed, I went to the ER. And I'm thinking if that happens again, it's a 30-minute ride out there. And that worries me.
The hospital closure in Douglas is not unique. Dozens of rural hospitals have closed across the U.S. in recent years. But for Douglas, the closure has a ripple effect.
Well, it's a tremendous loss to our community. First of all, for our citizens that reside here, it's an extra 20-minute to half-hour drive, either in your car or by ambulance, to the nearest hospital. And of course, on the economic development side, it's terrible when we're trying to recruit businesses or new people to live in our community. To know we do not have a hospital is very impactful.
That's a huge deal for retirees and even locals that are getting older or needing more medical care or whatever else. That's a huge deal for us to lose the hospital.
Not far from City Hall sits the Avenue Hotel. The buildings date back more than 100 years, and establishments like this feel the loss of banks, grocery stores, and the hospital.
It's sad from a business person's perspective. It seems like the town's dying. And I hate that because I really do love Douglas. When you drive down the street on a Friday or Saturday night and there's two cars or something, it's nothing. On the weekends, we get a bunch of people, we get a lot of bikers. I hear them come by all the time. But they come down and they maybe, take a look at the Gadsden and then they're gone. They aren't staying and they're not usually eating and drinking, they're passing through.
Solving those problems falls on the steps of City Hall. How does a small town convince stores, and especially a hospital, to return?
There's towns smaller than us that do have hospitals. We've looked at a hospital taxing district as well. There's a lot of out-of-town property owners, so they felt it was a little difficult. I think they need to relook at the boundaries they looked at and rein it in a bit and focus more on just the community of Douglas itself.
Raising taxes, even to open a new hospital, can be a tough sell for a mayor, but he may have some support.
I know I would. I'm looking out for my family and my friends. I think everybody else in town would be doing the same. Our future in the city of Douglas.
The future of Douglas, though, is still an open book.
I'd love to say the future looks bright, but from where I'm standing, it's not looking so bright.
The drive from Douglas to Bisbee is about a 30-minute trip, and in an emergency, every minute counts. To help ease the burden, Copper Queen Community Hospital in Bisbee operates a quick care clinic in Douglas and recently announced it will soon open a freestanding ER in Douglas. Hospital CEO Jim Dixon says Copper Queen Community Hospital immediately felt an increase when the facility in Douglas shut its doors.
We've seen an increase of 65% of our emergency room patients. Where we used to be doing 20-something a day, we're now seeing about close to 60. But we were prepared for this. We realized that the biggest growth area in healthcare is outpatient, ER, and that. And we had just enlarged our ER from 7 beds to 11 beds. So we're able to take the patient load and give them good service. And that the travel time is somewhat hard on some people, but it's no further than you travel if you live in Tucson, as distance from a hospital, or Phoenix. And we've seen over 50% of those patients don't need an ER. They need to go to their doctor's office and that. So the lightweight nature of the ER patient makes it easier to handle too.
The majority of the patients increasing that you're seeing, are they ER cases, or did you get an across-the-board increase in hospital
Well,
service?
let's put there, ER patients, across the board, 50% of those are not in need of emergency room care, which is very expensive. To that end, we already built and we opened up the Monday after the hospital closed on Friday, what we call a quick care. And that's in essence a walk-in clinic with advanced diagnostics such as CAT scan, radiology, laboratory, and that. So we can do low-level ER there for approximately $175 a visit, whereas if you come into our ER, it's $750. And we work with the state access program that all patients who have Medicaid can utilize that without going through their primary care physician. So that really creates access to care that was not there before. We're seeing 30 patients a day in that alone.
Let's talk about what this does to rural health care in general. You and I talked probably 2 years ago about the state of rural health care, and you predicted that some of the hospitals down here were going to close, and sure enough, we just saw Douglas close. What's the state of rural health care?
Well, you've got to separate two things. The inpatient acute care, as we call it in the industry, is diminishing. The low-level acuity patient doesn't go into a hospital anymore. As a matter of fact, Medicare and that are causing disincentives. So about 5 or 6 years ago, we shifted to outpatient. Over 95% of our care is rendered on an outpatient basis, 5% in the hospital. That's what happened to Douglas. They were almost strictly oriented towards inpatient care, and the population, the staff or patients to put into bed is just not there anymore. And so they imploded. They had financial problems, which caused operational problems, and Medicare came in and cited them and closed them.
Is that how Copper Queen manages to expand? You opened up the new ER, you opened up the new urgent care. Is that how you're expanding?
We pushed our care into the ambulatory market, where the biggest growth is. As a matter of fact, today, so that the people at Douglas don't have to travel so far, Copper Queen Community Hospital's board of directors voted to put in a freestanding emergency room on our campus in Douglas. And it will have 4 observation beds so that people can come in, get emergency level care. If they need to be watched for a short while, they'll be able to be kept on those beds and then go home. If you tried to do that with an acute care dinosaur, which is what a lot of hospitals in the rural area are becoming, it would not be successful. You could not get enough patient volume to cover the overhead of operating. So we have gone to where the market is going. We have pushed it to where they're telling us we need to go, and we were prepared for this. Now, it is devastating for a town to lose their hospital, to lose 70 jobs, but I'll tell you, on my prediction, they're closing hospitals faster than they've ever occurred in rural areas. Over 51 hospitals closed in the last 2 years, rural hospitals, and the ones that are barely staying alive are in healthcare districts where they're using tax money to support the healthcare. We don't believe in that. We don't believe people should be taxed and then have to pay their healthcare bill also. So we operate with that in mind, and we're a very low-cost hospital.
What's the health of rural healthcare in southern Arizona especially?
I think that as we expand our services, and we've added doctors and that, it's getting better, but it's still at risk. It's really at risk because you don't have the specialists and that available. If you have a sick child in Cochise County, there's no inpatient beds. So we have now put together a telepediatric program through Cardin Children's Hospital in Phoenix. And they are on consult into our ER at all times. Our nurses are going up to be trained. So the treatment is getting better, but the disease that the population has is not getting better. We have got to go a long way for weight reduction, exercise, and those things that make people healthier.
Is Douglas the last to close rural health facility in southern Arizona?
There was another one in southern Arizona, yes. It's the last one to close as of now.
Well, I guess I meant, will it be the last to close, do you think? Or will
Unless
there be
they
more?
change, there'll be more. Because you can't run a hospital based upon inpatient services. You have to move it over. When I started in healthcare, 85% of a hospital's business was inpatient or acute. Now we're at 95 out, 5% in. So you can see the way the industry is shifting. If you don't sense that wind and change your services, you will be out, you will be closed.
This past April, the hospital in Sierra Vista expanded and opened a new facility. It now offers a Level 3 trauma center in Cochise County. Lorraine Rivera spoke with Dr. Dean French, CEO of the Canyon Vista Medical Center in Sierra Vista.
Cochise County is a very rural county. Are there challenges associated with servicing the population?
Well, I don't think there's particularly unique challenges. Sierra Vista itself is actually a fairly urban environment, and then the county has a rural and some places frontier interface. We have good ambulatory care services throughout the county, particularly through Chiricahua Community Healthcare Clinics, which is a federally qualified healthcare clinic, not for profit, which has a presence in almost all the communities in Cochise County. Copper Queen has several ambulatory platforms through the county. The Benson Hospital, Wilcox Hospital. So there's a good base of primary care services through the county, so people have access in most areas. And our goal is to be the regional referral center for those facilities.
Last time we spoke, you had said the hospital would be hiring more physicians to handle more patients. Did that happen?
Yes, we've hired, since I started, we've hired 25 physicians, or providers, I should say. So it's not everyone we've hired is a physician. We've hired some nurse practitioners and some physician assistants also. But we have an aggressive recruiting plan, and we've been exceeding our goals.
One of your newer services is behavioral health.
Yes, so one of the things that we recognized early on in our relationship in this county was that there were no acute behavioral health services in southern Arizona. And in fact, I think last time you and I talked, we had a pattern throughout the county and throughout southern Arizona where patients that were in need of acute behavioral health services were sitting in emergency rooms throughout southern Arizona waiting to get behavioral health beds elsewhere in the state, which is a very difficult thing for the patient and for the facilities because emergency rooms are really not designed to adequately care for behavioral health patients and their acute needs. We built a 19-bed acute behavioral health unit here with the opening of the hospital. We have 15 adult beds, and we have 4 geriatric beds. So it's filling a need that was desperately needed in the community, and we've been essentially full since we opened.
Some of the challenges that the Douglas Hospital faced, do those challenges run up north here to Sierra Vista, or do they come this direction as well?
Well, the challenges the Douglas Hospital faced are complex, and frankly, I can't put them into a soundbite, but they had to do with location, age of facility, management issues. It is a misnomer to say that the Douglas Hospital closed because of financial concerns. It's actually not true. They had significant issues with meeting state regulatory requirements and CMS requirements. And it's really an unfortunate thing that hospital closed because I think a community of 17,000 could support a robust community hospital. And in fact, if you look through Arizona, there are communities that size throughout the state with hospitals that are quite successful in them. So it's not a simple, quick answer as to why the Douglas facility failed.
Being a physician, that's disappointing for you, for a hospital to leave a community like that. What are the repercussions for people who live in Douglas?
Well, the big repercussion is access to care. If you're needing a surgical procedure, if you're needing just a short stay admission in a community hospital, those things are normally available in a city the size of Douglas, and now they're not. It means they have to travel either to Copper Queen or to Sierra Vista to get that same service. That means lots of increased hardships for families, for patients. It also means increased hardships on the infrastructure for Douglas, in particular the city of Douglas, because their fire department now has to really extend themselves in order to get patients to the care they need, which presents some challenges, I would think, in them being able to provide the crews and teams they need to cover the city if they constantly have to send them out of town.
There are people who are from rural communities and still are skeptical of going to the bigger, newer hospital in Sierra Vista. They'd rather make the trip to Tucson or Phoenix. What do you say to them?
Well, I don't say anything to them. I think the biggest thing I can do and what this facility can do is show every day that we're providing high quality care great customer service to the patients of Southern Arizona. And over time, that reputation will build, and that will be an issue. I think it's incumbent on us to provide the services and provide them in a quality way so people through word of mouth know that and come here. And we're seeing that. We're seeing significant improvement in our market share in most of our service lines. So people are starting to make that choice.
Does this hospital run the risk of not sustaining itself given its size and the population?
No, I think the proof of the pudding is actually the fact that we're growing. We've had a 10 to 15% growth in almost all of our service lines this past year over year. And we've seen an increase in our market share. And that's in the face of a shrinking population. Sierra Vista is not currently growing. It has shrunk a little bit because of some contractures over at Fort Huachuca. And despite that, the hospital and its services are growing. So that tells me that we are sustainable. And in fact, we need to invest more in the healthcare locally. Healthcare is an economic pillar. Cochise County in particular is at risk of not having a strong economy if it doesn't have a strong healthcare economy. And so my view, and I think the view of our board, is that we need to put as many services in place that are sustainable by the population we serve, and there's good metrics to look at to understand that, and keep patients here. By doing that, we actually create a growth structure for the economy as a whole. So that's the answer for Douglas, that's the answer for Sierra Vista. If there isn't a strong economic medical community here, and that community becomes what I call a medical desert, it's going to be very difficult to grow the economy in general in this part of the state. There are certain areas of the state that are actually over-providered. Tucson is one of those areas. And as they have more providers and beds than they actually need, they tend to look towards places like here and try to get patients to come there. The downside and the danger of that is you actually undermine the economic foundation of this community. It's going to be difficult to attract new industries. It's going to be difficult to maintain the military installations that are here if there's not a robust healthcare community here. So our mission is get doctors here, get providers here, build up service lines that support the community can grow from, and that can sustain the military establishment that's here and make sure that it's getting the services it needs locally.
In recent years, more than 50 hospitals have closed throughout the country. Dr. Dan Dirksen and the Arizona Center for Rural Health examine what causes rural hospitals to close and the future for rural health care.
The precipitating factor that ultimately resulted in its closure was that Medicare stopped paying the hospital. And as a result, it's a program under the Centers for Medicare and Medicaid Services. So whenever Medicare stops payment, Medicaid quickly follows suit. And for our rural hospitals in Arizona or any state, sometimes Medicaid and Medicare represent 40 to 60% of the revenues that come into a hospital. So if you don't have enough revenue coming in, you can't make payroll and you have to close your doors.
There are other hospitals in towns the size of Douglas who are able to manage their facilities. Do they run the risk of falling short when it comes to money for Medicare and Medicaid payments?
There's been some recent studies nationwide that about 280 hospitals in rural areas across the country are at risk of closure because of being in very precarious fiscal situations. In Arizona, we've been fairly lucky that we haven't had very many closures over the years, but it's a tragedy for a community such as Douglas when their major healthcare infrastructure, the rural hospital, closes. And I believe that 70 people lost their jobs when the hospital closed, and it's very hard when a rural hospital is closed for them, for the community to come together and reopen the doors. Usually once these things shut down, that's the end of it.
More than 50 hospitals across the country in the last 5 years that have closed. I mean, what's really happening?
Well, the rate of closure has really accelerated for a number of reasons across the country. Many of the hospital closures are in states that haven't yet expanded Medicaid as allowed under the Affordable Care Act. There's a number of hospitals, the state with the largest number of hospitals both at risk of closure and closing have been in Texas, for example, that hasn't chosen to expand Medicaid in their state. But even states that have expanded Medicaid, such as Arizona, Often the hospital finances are so marginal that any change in payment flow can put them at risk of closure. There's a metric that's used to look at the fiscal health of hospitals, and they call it days cash on hand. And it's the number of days that you can remain open and make payroll and cover your expenses without receiving a dollar in revenues. And normally you'd want 3 to 6 months or longer of days cash on hand, that margin, so that if something changes in payment that you can remain open. The average days cash on hand in Arizona's critical access hospitals is 21 days. And the critical access hospitals are those in very rural areas, small, only 25 beds or less. They have to have a 24-hour a day, 7-day a week emergency medicine services. So once those go, it's very hard to reconstruct them.
The hospital closes, and then what happens to the town? How does it rebound from that?
Well, I think there's a grieving period and there's a settling period. They're fortunate in that other entities have come in and expanded some of the primary care and urgent care services available. One of the major problems with it is that when you're in a remote community, when you're in a rural area, and you have emergency medicine services 24/7, when that goes away, often it's a delay then in those people that may get injured, you know, on a farm job or in the machinery or along the highway. The transport can take 20 to 30 minutes longer to the next level of service, or you have to arrange for very expensive helicopter or fixed wing aircraft transport to a facility that can provide those emergency services.
So with along the lines of it's closed now, what's the risk overall for people who might make that drive to Bisbee or may have to rely on this new urgent care facility that the Bisbee Hospital will put in town? I mean, it's not the same level of care, is it?
It's not quite the same level, although most of the fiscally successful rural hospitals have changed the way they do business. It used to be before that it was more lucrative to do inpatient services and admit people to the hospital and care for them there. Well, that's become quite expensive, and unless you're offering a full array of services, all the way to tertiary and quaternary care services, the subspecialty services, it's hard. So the successful ones have changed the way they do business, such as Copper Queen and Bisbee has really changed it so that they do far more primary care services, ancillary services, imaging, laboratory, other things, to really diversify their revenue portfolio so that they're not so vulnerable to, you know, maybe there's a few weeks where you don't have any admissions, but you're still having to pay the nurses and the physicians and others to staff those hospital beds. So when you diversify, when you change the way you do your business and adapt to this rapidly changing healthcare system, you tend to do better.
Regardless of a town's size, healthcare is important, and I mean this could have far-reaching effects.
It's already had some effects. You know, real people lost real jobs, and that's of concern. The health system provides good paying jobs and attracts well-trained people to that community, and often the healthcare infrastructure creates a nice building block for other structures to come in, the grocery stores and the service industries, and maybe a nursing home comes in. When that starts to unravel and the safety net unravels for healthcare services, people delay their care, or they have to drive very long distances to get that care. When they need, you know, sutures in the middle of the night for a laceration or something, or your child gets sick and requires, you know, some asthma treatment or something like that, that 30 to 40 minute difference can make a huge difference in outcomes.
And the livelihood of the town is really dependent on the health program.
In addition to those challenges that rural areas have and critical access hospitals and rural hospitals, there's also a number of opportunities right now. And certainly in Arizona, we've seen an expansion of health insurance coverage, whether it's through Arizona's federally facilitated marketplace or through the Medicaid restoration and expansion that happened. So more people are covered. So it puts us in a better fiscal position for these hospitals. When you don't cover people, when you have a lot of uninsured in a community, as we see so often in the southern counties in Arizona, when people aren't covered, you're just shifting costs to uncompensated care, and you're asking hospitals and health providers to absorb that cost in uncompensated care, and that's the hidden tax on that hospital and healthcare provider physician system. So I think it's important that we continue to try to get as many eligible uninsured enrolled as possible. We have those opportunities before us. There's still 200 to 300,000 Arizonans who could be enrolled in health insurance marketplaces where approximately 75% of their premium would be paid for in this marketplace to make those health plans affordable. When people have coverage that helps the health system maintain a healthy bottom line so that they continue to offer the services, expand and diversify the services they offer, because I think a healthy community depends on a healthy infrastructure, the hospital, the clinic system, the providers. And when one of those systems starts to unravel, it affects all the other systems and the other businesses in town. So for job growth, for economic development, it's important that we pay attention to those things that assure a strong and vibrant health system.
And that's our program. Thanks for joining us. Next week, we take a look at the Tucson-Phoenix Rail Project, and we'll also hear from Governor Doug Ducey. Before we go, a tribute to the men and women killed 14 years ago on 9/11.